Over the past years, Ghana has developed tremendously in some sectors, but not too well in the sanitation sector. Ghana is one of the lowest in terms of access to basic sanitation worldwide. Out of the total population of Ghana, 10% use the unimproved sanitation facilities. 14% have access to basic sanitation facilities. 19% practice open defecation. 57% use the limited or shared sanitation facility. The disparities observed in the low sanitation access statistics is also a source of national worry. For example, open defecation is recorded 3% in the Ashanti region and 89% in the Upper East region. Approximately 19,000 Ghanaians, including 3,560 children under 5 years, die each year from diarrhea, nearly 90% of which is directly attributed to open defecation, unsafe water, improper sanitation and hygiene. Ghana ranks lowest in sanitation levels among all lower middle income countries, although richer than a lot.
Basically, sanitation, they say, is a way of life. It is the quality of living that is expressed in clean home, clean farm, clean office. As a way of life, it must come from within the people.
As a country, we have not done well at all when it comes to access to improved sanitation. Going back into the era of the MDGs, we were only able to get as far as to 15%. That is access to improved sanitation countrywide. And that is not a record that we can be proud of at all.
There are people who have not been part of our activities. They are excluded and they don't have the means to really be part of our programs. And these are the vulnerable and the poor people we see in our communities.
Those who lack access can be categorized into 2 or 3, but broadly speaking, I would say 2. We have those who have a capacity to be able to pay. And then there is the other segment who do not have a capacity at all. And that is the vulnerable and the poor.
We have come face to face with stark poverty, stark vulnerability. And we feel that we don't have an excuse if we don't deal with these situations. Imagine situations where poor households invest their meager income in building latrines that will not survive the rainy season. So year in, year out, they spend money building these latrines to the extent that they spend more than those of us in the urban areas owning water closets and so on. They also have children who go to school, children who are likely to fall ill because of lack of toilets in their schools. And again, they spend their little income to pay for medical attention. And in some cases, we're losing children out of lack of safe access to sanitation.
One of the big issues that we found is that the poorest of the poor usually live between $1 and $2 per day. And this does not allow them to construct a proper latrine, because sanitation is probably one of the least priorities they have. Normally, the little money that they will have, they will use it for, number 1, food, secondly for education, and thirdly for sanitation.
We've been supporting with water supply and sanitation investment to ensure that the poor are provided for, with water supply and also developments in sanitation. For some time now, we realize that in spite of all the investment that we have made in the past, we still have a long way to go so far as the poor is concerned.
These are the voices of some vulnerable and poor in certain communities in the Greater Accra region.
na kenyo kweti hu na masani be trafi no ikpa mepe ayi ka bo na ba pe ko ka hami na de be de ni ma achi chan he ko abanye la pe ga ma mi kla ka be se ni be no ko ipo ko wi no ikpa mepe aba pe ko hami
hu lo ji le lo we ka no fe no bo para ka ichu ka bi ju ko le driver bi ba pa mo ka lo le yo na le ni ba pe ko yin no ko chuwe yin no ko chuwe se ye bi omo ka aho ni apo han ke ni ko no bela na momo àwa mi ke ni ko en bobo so pe yan gba mi o ni ko bi hawo ke isiwu le ko keke ko ji yan gba mi le ke si we ri ji ko nche ko mi le cho so ngana le di ma fo atubo pepe no cho efe ko na tu waye mi ke ne na so ke ma pe ame manye ma pe ame o ka ba wa mi o le pio no imanye ne ma pe fari ne ke no ko ba na ne pe afe o igbinga ki ne jukun ko me na pete ke wo lo ipun e yo ni fi e di nya gba mi ji be no ko nya na ne
fie ni me ne nana ne me ma na egu ha ye dware nyina sei ministry bi a me di beye toilet no e na toilet na ye ni ha ni nti no yetumi eyegu rubber mu nyame adum na sensu oto a ne ye de atum na ekọ sensu nso anto a eni o utu etwini obi efikyira menim se no na ema yare enkitinkiti eba kronim na esa ne se yempesa sa yare mba nti misra ba no so betumi aye hu bibia me
ne mo pele wa hu ni chumi ko pa be wa denga hi hu ye bio no ha mi nya gba pa ese ga ka ya pe no ko hu inyo e maje ke ba kan wa makutu pe ko hu inyo we ko lo ja ma nya gba e nga no wa we ka je ye bio benye ma pa ka hu ke ya bele ma ni ati oke wa ya ngamile wa ya nga se ne me na nga wa kasa mi kla ne mele sikanga dun api agbocho se wa mi ki kone no ko be dun kolo yin agbocho ko ne ma pe kolo ke yo mi nga no pepe nya gba ke ha wo akolo ji nya gba e ko me iwo polity bagian le gba wo mi ka ya fun jama yo ne anunu me ka mano apale ma ba mano nga wi o mi yo e ha le kolla yo no hu
ki o iwu le ibe trafi lo kina no kunde ke mai ke bwanu manima awo kuko ke bayola batu feja bi omi ni binu ko yin ni matu ko lo ibe ku lo nganu le waya o isun ke ni ko me baraka sumo na ma pe ni ma pe na pe
Open defecation is one of the challenges the Assembly is actually finding solutions to. And thanks to our donor support and agencies, we've been able to do much. It is no news that currently we have, as a district, 7 communities declared ODF, open defecation free, under the CLTS program. We want to do more. And as we speak, we have 8 more communities at various stages of completion, waiting for verification. And therefore, we are asking on donor agencies to partner with national, with the various assemblies, to see how we can support in this goal to help eliminate open defecation in the district and the nation as a whole.
Every individual within the community must have a decent latrine for safe disposal of human excreta, or what we call liquid waste. Until this is achieved, we all run a risk, because it just takes one fly to sit on feces, and then the rest of the community is at risk. So it is very important that we look at pro-poor strategies in our sanitation work.
The pro-poor guidelines was developed with emphasis on the poor and vulnerable in our society to make sure that they are not left out and they are well catered for in terms of our sanitation delivery efforts.
We are much concerned about these poor people because the statistics shows that the poor people are 7 times likely to defecate in the open than the rich people. Therefore, how do we support them? We want to support them through very innovative approaches and options where the poor will be properly targeted and supported to own their own latrine, at least to also help in stopping the open defecation.
Certainly, the fight is a Herculean one, and as a government, we cannot fight it alone. We need all hands on deck to support us. So here, I'm calling on our collaborators, the development partners, the international NGOs, local NGOs, individual philanthropists within the country, and corporate Ghana as a whole to come and support us as we seek to improve upon our performance as far as sanitation delivery in Ghana is concerned.
Benefits of providing toilet for the poor cannot be overemphasized. Usually, the poor people who are marginalized always feel the inner satisfaction of at least getting support from the community members and other external sources to also own their latrines. It's also great joy for you to see them always opening their own toilet facilities, accessing them and maintaining them. And that's the focus of the ministry, because once again, the statistics shows that, I mean, in trying to have an open defecation-free community, always when the community attains 80% of people living in the community having access to household toilets, then we say that the community is open defecation-free.
Generally, we need to understand that government has put in a lot of effort to improve sanitation, but it is still unfinished business. We need to work together as a collective, talk about the government, talk about the private sector, talk about international NGOs, talk about local NGOs, talk about communities, that we need to work together collectively to deal with the sanitation challenge, definitely. Once we're able to do that, health will improve, livelihoods would improve, and there will be total human development in the communities.
Pro-poor guidelines document has been put together as a framework to guide the participation of our collaborators in supporting us to fight the sanitation challenge. The ministry at the forefront of sanitation in the country. We are not oblivious of the fact that we need collaborators and we need stakeholders to help us fight this sanitation challenge.
I want to take this opportunity to thank the government of Ghana, the Ministry of Sanitation and Water, for embracing this idea and carrying forward this project. The same way I want to thank all the stakeholders and implementing partners as well that have contributed to the development of these guidelines. And I hope that all of them will embrace and implement this across Ghana.
The current low access rate for sanitation in Ghana, coupled with the high targets set by the Sustainable Development Goals for the country, calls for a shift in development thinking. For sanitation and hygiene in particular, sanitation sector in Ghana needs to think broadly to include sustainability and equity goals more explicitly. Increasing momentum around the realization of human rights, sanitation is also putting emphasis on non-discriminatory service delivery. In growing recognition of disparities in sanitation access, there is a need for more evidence of effective approaches to ensure more equitable service provision for all. In order to address disparities in basic sanitation service delivery in Ghana, there is a need for better understanding of what sanitation poverty and vulnerability mean. Analyze the barriers to sanitation access for these poor and socially excluded groups, identifying existing community solutions and subsequently supporting them without distorting the current community cohesion achieved through long years of implementing CLTS in Ghana. In all these discussions, Proper targeting is key. The guidelines for targeting the poor and vulnerable for basic sanitation service in Ghana, developed by Ministry of Sanitation and Water Resources, is a bold attempt to provide guidance for all sector players to achieve this objective of pushing sanitation assets to scale without leaving anyone behind.
We should all work together as partners to promote Clean Ghana, and also I want to appeal to all Ghanaians that if we love the country, we should obey the basic sanitation laws to make sure that the country is clean, the country is green, the country among the neatest countries all over the world, so that we can turn Ghana into the Garden of Eden.